floors, the people on the first floor would have plenty of pressure. The people on the second floor, it might just barely dribble out because they just wouldn't have enough pressure to pump it up to their house. Resistance is any force that opposes movement. In this case, anything that opposes blood flow. Total peripheral resistance is the resistance of the entire system. Turbulence is just what it says. It's irregular swirling, usually caused by irregular surfaces. Vascular resistance is due to that, mostly due to vasoconstriction. It's caused by friction of the wall. It's caused by the diameter. If you decrease the diameter, you obviously decrease the vascular resistance. So indeed, those muscular arterioles that we talked about increase your vascular resistance. And the venous pressure, as the blood is flowing back through the veins, it depends a lot on not only hydrostatic pressure, but also the thickness of the blood, because the pressure is quite low. The thickness of the blood matters even more in the veins. Now, here's a bunch of things you need to think about. Once again, this is why I like this PhysioX. Think about these for just a second. Don't try to memorize them right now. Just think. Flow is proportional to pressure. The higher the pressure your heart is generating, the more flow. Right? More pressure, more flow. Flow is inversely proportional to resistance. You've got the same amount of pressure coming out of the heart, but as you increase that resistance out in the periphery in those little blood vessels, that's going to inversely affect flow. If the flow stays the same and the resistance goes up, this makes it go down because it's inversely proportional. Flow is directly proportional to the pressure gradient and inversely proportional to the resistance. That's just a combination of the first two formulas. Flow is directly proportional to blood pressure and inversely proportional to peripheral resistance. Once again, it's sort of a combination of the top two. And the last one, which is maybe the most important one, you'll see this one on the test, I can promise you, is that the resistance of any blood vessel is inversely proportional to the fourth power of the vessel radius. Whoa! So as vessels get narrower, they really jack up their resistance. That's why arteriosclerosis kills so badly, because arteriosclerosis causes narrowing of the arteries, which increases the resistance, and it's inversely proportional to the fourth power with the radius. So as the radius gets smaller, the resistance really goes up. Here's the thing you need to understand. There'll be a problem on this as well on the test. Systolic pressure is the peak arterial pressure during ventricular systole. All right, let me go back with my magic marker, assuming I can find it up here again. Y'all see where I left it? Oh.
It's in your pen or your hat.
Or it's in my pocket. Oh, yeah, okay, thank you. I'm so glad my head is attached. I'll just use this nice clean board. Let's think about arterial pressure for a minute. It goes up and down with each heartbeat. And it goes from, say, 80 to 120. Okay? Now you notice that because diastole is longer than systole, systole is the time of the contraction, right? This time is shorter than this time than diastole. So therefore, we spend less time at 120 than we do at 80. Simple enough concept. So what we want to know is what is the pressure? I've changed it. Oh God, I changed it a lot, didn't I? Oh. Someday I'm going to just let one of y'all do it. Mean arterial pressure. This is a term you need to understand. M-A-P. Mean arterial pressure. So if your pressure is 120 over 80, what's the mean pressure? What is the pressure that you're at if you could average out over the whole period of time? It would be somewhere in between, right? Because it spends some time above that line and some time below that line. The fact is it spends 2/3 of the time below the line and 1/3 of the time above the line. So the way we calculate it is like this. Mean arterial pressure is diastolic pressure plus 1/3 of the pulse pressure. In other words, for this case right here, mean arterial pressure, I can hardly read probably. Mean arterial pressure equals 80, because that's the diastolic pressure, plus 1/3 of the pulse pressure. The pulse pressure is the difference between the 80 and the 120, so it would be plus 1/3 of 40 in this case. Okay, and what would that work out to be? Well, 1/3 of 40 is 13 plus 80, so the mean arterial pressure then is 93. But the way to think about that is 93 is 1/3 of the way up. This is 1/3, and it's 2/3 of the way down. I hope that makes a little bit of sense. But you need to know mean arterial pressure. Normal blood pressure is listed there at 120 over 80. Nobody stays at 120 over 80 all the time. Usually when you go to the doctor's office, it's a little bit high. Depends on how much salt you've had to eat in the last day, usually. A lot of other factors. Hypertension is the term that means high blood pressure. And we consider, in medicine, we consider hypertension to be any pressure that's greater than 140 over 90. In other words, if you're 130 over 85, nobody's going to say anything. You're certainly not going to be treated with high blood pressure medicines until you at least get to this number. In fact, you're probably not going to be treated until you get to this number and you're found to be there for a number of visits before you get put on blood pressure medications. Hypotension is just the opposite. It's an abnormally low blood pressure. And I think the concept I would make is there's no such thing as low blood pressure as long as you're asymptomatic. My wife runs blood pressures of 72 over 40 and doesn't affect her in any way. She doesn't get lightheaded when she stands up. She can exercise. She can do anything. Some people just run low blood pressure, and there's nothing wrong with having low blood pressure as long as you're not symptomatic from it. Now, if you start getting dizzy, then it can be a problem. Obviously, severe hypotension is called shock, when your blood pressure really goes down. Let's stop right here on elastic rebound. And what I'd like to do is pass a bunch of tests back right now, and then we will go over the tests over in lab, okay? But this will give me a few minutes, hopefully, to get them handed back. Did everybody turn in their lab sheets? Have I graded them yet? Have you gotten the 10 points for?
Yeah. You didn't write on our pages.
I didn't write anything on them. I just gave you 10 if you did them. Yeah, okay. Well, the essay exams, just so you know, about a third of you probably made 50 on them. Most of you who had prepared for them had practiced them, made 50. Clea? Where's Clea Brandenburg? Vanessa Rodriguez? Brooke? Now, if you said something wrong in your essay that was just totally wrong, I subtracted a point or two for that. And you couldn't make that back up. You know, if you had 27 right things, but you had 2 wrong, you still got 23. Okay? Ms. Trevino? And Alvin? I'm still trying to figure out what your first name is. Lori Lounsbury. Good job. Alexandria Pena. There you are. Corin Lehman. Patricia Sayer. And Madeline Snyder. She's back here. And Bradley. Michelle Lopez. And Tia Salmeri. She's over here. Darren Sullivan. Aisha. Bradley Thompson. Leanne Frazier. Yeah. So you sent me that thing?
Yeah.
I haven't seen it. I haven't looked at my. Casey Shepard. Casey Shepard, who is a lady. And Arroya Strobel. Miss Strobel. Strebel. Strebel.
She's not.
Okay. Here's a bunch of quizzes. I think I'll just lay them out and let you guys find your own quiz. How about that? These are the blood quizzes. Y'all can just help me spread them out so the names show, so everybody can grab theirs. I'm done carrying those papers around now.
So what are you looking for? 25 facts?
25 facts. Read the rubric.